Health concerns and precautions of flexibility training would be arthritis, muscular imbalance, osteoporosis, hip fracture, and replacement. Arthritis, in Chapter 9, we talked about arthritis in special populations, but flexibility training recommendations for someone that has arthritis, both types of arthritis. You want to do this daily. You want extended warm-ups to help reduce joint stiffness, and you want to reduce exercise intensity and duration during periods of acute inflammation or pain. Muscular imbalance leads to, or you want to avoid repetitive movements, things involving poor posture and tight muscles, and those three things lead to alignment issues that can lead to an injury. So through flexibility training, you can help to improve those and help prevent injury. Now, osteoporosis, I also discussed in Chapter 9, Special Populations. Guidelines for someone with osteoporosis is to avoid repetitive exercises that involve spinal flexion or twisting. And you want to suggest exercises that help to improve posture and spinal alignment. Lastly, hip fracture and replacement. It's recommended with individuals that have had a hip fracture or replacement that you avoid internal rotation of the hip adduction, and hip flexion. Overstretching. The easiest way to overstretch is to stretch cold muscles without any warm-up. And when you overstretch, you increase the time that it takes for you to improve your flexibility. Feelings that you experience during stretching starts out with a localized warmth of the stretched muscle. This occurs at the origin or the insertion where it starts and ends. And this is your first clue that you need to pay attention to the intensity of the stretch. Now the next feeling is a burning sensation or spasm-like sensation, and that is telling you to ease up or discontinue the stretch. And you will probably be sore the following day if you push your flexibility training to this burning sensation. Next stage is the sharp pain. If you are feeling this pain, you have already damaged your muscles and you will be feeling pain, and it will probably persist for several days. Developing a flexibility program, just like we do with weight training, with cardiovascular training, we are going to look at frequency, intensity, time, and type. Frequency, it's great for your body to stretch every day. So 7 days a week is the frequency recommended. As often as you can, or at least as often as you work any major muscle group. Intensity as it relates to flexibility deals with the depth of the stretch, how you execute the stretch, the point that you reach mild discomfort, the point of pain is too far. Now, as far as time, that's how long you should stretch. You want 10 to 15 minutes per day, holding each stretch for 15 to 30 seconds. The longer you can comfortably hold a stretch, the better it will improve your flexibility. The type of stretching, that's the activities that count as stretching. And the two most common and accepted techniques are for improving flexibility are static and PNF stretching.